Uh, oh, thank you. So regardless of how the application goes, we know climate health is a very high priority for all of us. It affects each one of us and our communities. And the work that Dalberg Design is doing in community activation is really powerful. So I'm very excited for them to share. I'm going to introduce Robert Fabricant, who is the co-founder of Dalberg Design, and then Robert will introduce his wonderful team. Robert is a born and raised New Yorker and really an expert in human-centered design and systems thinking to solve these very complex and sticky issues in producing social impact and community engagement. So very excited to have you here, Robert. And at Dalberg, Robert really leads a very diverse and a global team, all the way from studios in Dakar to Mexico to Mumbai, which is very exciting personally to me, Nairobi, New York. And so very robust portfolio focused on public health. And if you read Robert's bio, it's very extensive and very global, and we're very honored and excited to have him speak with us today. So Robert, I'll hand it over to you. And this is the second, if you didn't see our first networking session with Dalberg Design, this is actually the second in a two-part series with them. The first was the 2-year engagement with Houston Endowment to increase citizenship rates among Houston's many diverse immigrant communities through a collaborative co-design approach. We recorded that particular networking session. It is available, and Wes can share the link in the chat. But this is the second. That's today we're going to be focusing on climate health. So with that, Robert, I'll hand it over to you.
Yeah, thank you, Srila. And I'm just going to speak for a couple of minutes and hand it off to an incredible team. I do want to say I feel equally fortunate. I'm the one of all the folks on this call on the Dalberg side who's been spending the most time in Houston, and really fortunate to get to know a lot of folks in the community, including you, Srila. And so, yeah, last time it was a bit more of a deep dive into the kind of community engagement, human-centered design work we do. But as Srila mentioned, we first connected on the intersecting challenges that are represented in Houston as much as anywhere else between health equity and climate justice. So I wanted to broaden that perspective. So if you didn't join us last time, if you see the recording, it was a very Houston-specific conversation. This is going to be a bit broader. And as part of it being broader, even though I founded and run a design team at Dalberg, Erin and Laura and Julia will be exposing you to a broader set of work, both in the US and globally. That really gets at the challenges that so many funders and other institutions are facing as they kind of grapple with this, the intersection of these two challenging issues. So I'm going to hand to Erin, who leads our health and nutrition practice, has been an amazing collaborator of mine for 10 years. So I'm going to hand it off to her. She can introduce Laura and Julia, step through a bit of this content, give you some perspective on what we're learning in a lot of other places in the US and abroad, and then hopefully we'll have some time to chat. Yeah, so over to you, Erin.
Thanks, Robert, and thanks, Srila, for the lovely welcome. It's so nice to meet many of you virtually. And as Robert said, we're looking forward today to really having a conversation with you all about some of what we're learning about the nexus of health and climate change, how we've seen other cities, communities, implementing partners respond to these shifts globally, and then how it may apply to you all in Houston. So we have just a few slides that we'll walk through, but do really want this to be a discussion. So actually the first slide, I know you all have introduced yourself in the chat, which is wonderful. And it's so helpful for us to see just the breadth of different experiences that you all are bringing to this conversation. But we'd love, as we start presenting, for you all to also share in the chat what impacts of climate change you are seeing on your community and on kind of the healthcare that you are trying to deliver within your community. So any fodder in the chat around that would be wonderful. As we present, please feel free to put questions or comments in the chat, what this sparks for you. And then we will, as I think Wes said, leave 20 minutes or so at the end for more of a discussion. But we can flip to the next slide, and I will briefly introduce myself, and then my colleagues will introduce themselves. As Robert said, I'm Erin. I'm a partner at Dalberg. I co-lead our health practice, and my work focuses both globally on issues of health equity and the intersection of climate and health in a global context, as well as in the US, looking deeply at how we can improve health equity in our own communities across the country, and also looking at how that's increasingly being affected by climate shifts. I will pass it to my two colleagues who join me, who lead a lot of this work at Dalberg as well. So maybe I'll pass it first to you, Julia, to introduce yourself.
Thanks, Erin. Can you all hear me all right? I have a bit of a double mute situation, so I always like to check. Wonderful to be with you all, and thank you for having us. My name is Julia Rohrer. I'm an associate partner with Dalberg, based in San Francisco, although currently calling in from Mexico City, and I co-lead our work on health equity across the U.S., really thinking about how we can prioritize community voice in public health systems and how to really design for equity from day one, which is even more important in the face of growing climate-related health events. So excited to chat a bit more about that with you all today and learn what you've been seeing in your communities as well. And I'll pass to Laura to introduce herself.
Sorry, can you all hear me? My computer seems to be glitching a little bit. Okay, great. Hi, nice to meet you all. I'm Laura McEown. I'm a senior project manager in our New York office, also with a focus on health equity, both domestically and internationally. I will be sharing a little bit more from a project I led with the Robert Wood Johnson Foundation on health trends sensing as well. Erin, back over to you.
Thank you both. So before we get into, we thought it would be most interesting, honestly, to share these kind of mini project spotlights with you so you can get into the details of what we're learning. But before we do that, just wanted to give you a quick overview of well, who we are, but that will be very quick, and then how we conceptualize of this climate health nexus. So we can go to the next slide. I think Robert covered parts of this, but Dalberg is very much a global advisory firm. Design is one of our core pillars and one of the core services that we bring, and really taking a community-centered approach to all of our work. But we also do work that is kind of pure strategy work. We do some work around big data and data insights. We do research work. So a fairly broad set of capabilities, and we are very much global in nature, as you'll see. And we think a lot of what we can bring into the social impact space and the public health spaces, this notion of how do we take the best practices across the globe, as we increasingly are seeing different kind of exemplars pop up elsewhere, and bring them into the communities where we live and work. We can move to the next slide. In the US, we really focus our work on topics related to justice, equity, and economic mobility. And so what this means to us is really being clear and naming some of the core principles that we believe in order to further issues of equity, health equity being a core one in the US. And so we talk a lot about taking a truly intersectional approach to the work that we do, and recognizing that even though, and you'll see this through the presentation today, right now we're speaking about health equity, we realize how much other factors influence, and I've already seen some of these in the chat, housing, kind of extreme weather events, et cetera, are influencing a person's ability to live and thrive in their life. And we also take a very intentionally, and you heard a lot about this from Robert and his team last time, if you were on, a very intentional approach to center on the communities most effective and ensure that we are seeking to shift power and really bring their voices in and decision-making into anything that we do. If we go to the next slide, I think here, this shifts a bit to give you a sense of the type of work that we are doing at the nexus of climate and health. And I think this is a much newer area, I will say, for many of our clients. It's emerged really in the last kind of 3 to 5 years, where our clients are starting to see that they cannot progress health equity and their kind of push to improve health outcomes without truly understanding the impacts that climate change is having on the work that they're doing and adapting their programs to be more inclusive of that impact. And so we've worked across a number of, you'll see on the left-hand side here, a number of large foundations, Rockefeller Foundation, the Wellcome Trust, Robert Wood Johnson Foundation, as Laura mentioned. We've worked with some kind of multi-stakeholder initiatives that kind of bring a collective together. We've worked with some city and state governments. You see the city of San Francisco here, but we've done a lot of work in California, especially some in New York City and New York State, among other states around the country. And our work at the intersection of climate and health has really spanned a range of topics. So we've thought a lot about what does it look like to better monitor data, kind of climate data, and integrate that into how we approach healthcare delivery. And we'll talk a little bit about that in a minute. We've looked at different financing models to account for the need to adapt health systems to better be resilient to climate change that is coming down the pike. We've looked at trends that are shifting and how those are affecting kind of how we need to build more of a climate lens into our health work, and much more. So not an exhaustive list, but just to give you a sense. And this is really meant to then ground us in at least how we at Dalberg are thinking about the impacts of climate on health. And so I think, as we all know, we have global warming, we have biodiversity loss on this top row. And so there's a whole slew of ways in which the climate and environment are changing. And that can be everything from water scarcity, I think I saw that mentioned in the chat already, shifts in food systems, a push towards urbanization, which is shifting kind of where we live, but also the kind of density of the spaces that we live in, shifts in biodiversity, uptick in natural disasters, which I saw some of you mention in the chat, changes in how we use land, and then shifts in pollution. So these are various ways that we're seeing climate shift. And those shifts are known to be affecting human health. And so in this second row on the slide, we outline a number of ways in which we see health being impacted. And that's everything from changing diseases and disease patterns, so shifts in kind of burden of non-communicable diseases or infectious diseases. It's creating an enormous burden that research has showed on mental health in terms of having to anticipate and adjust your life based on various climate shocks that are coming. The changes to food systems and land use are having significant impacts on nutrition. Natural disasters, amongst other things, are leading to displacement of our citizens, and that leads to kind of removal from kind of traditional health systems in some ways. And then it's having kind of detrimental impact on workforce, infrastructure, and supply chain for health. So hopefully many of these, I think, I've seen you all put in the chat, but hopefully this helps us conceive of the various ways in which at least we are seeing communities then be most affected by shifts in the environment that are hurting their health, essentially. Before we dive into examples, we did just want to, from our work, we did just also want to recognize some of the very real ways that I think you all are probably more acutely aware of since you sit in Houston day to day, but the kind of acute ways in which this is playing out for you locally. And so 4 big areas where we're seeing climate vulnerability that's affecting health in Houston or in the Houston vicinity. One is around food deserts, which I mentioned on the previous slide, but essentially about 16% of residents right now in the Houston area live in a food desert. And so this is obviously creating huge vulnerabilities at the household level, food insecurity, shifts in diet, malnutrition, etc. The second vulnerability is around respiratory disease. And so in kind of the Houston area, deaths caused by particles in the air, by pollution, have increased by 33 deaths per year, and those are especially affecting low-income communities. And I think this is something we'll talk about through our project examples as well, but we often see that the burden of climate impact on health is disproportionately affecting those in the lowest income or the most marginalized communities. The third is around water contamination. Again, I saw some of this in the chat as well, but increased flood risk and industrial pollution combined then leads to water contamination. And so I think in the aftermath of Hurricane Harvey especially, there was contaminated flood water that then disproportionately affected vulnerable communities again. And the last is heat related, which I saw in the chat as well. And so the Harris County, just as one example in the area, has seen a 329% increase in heat related illnesses. And again, that's very much kind of disproportionately affecting lower income communities. So with that, I think we will shift to our first project spotlight, which actually is a nice build on the heat related point. What I will say, I mentioned this earlier, is both of these project spotlights very much take a global lens in nature, but what we've found is that there's a lot actually that we can learn from these global examples, and then hopefully will be fodder for Houston and other cities in the US. So look forward to kind of bringing some of that out more in the discussion, but I will pass it over to you, Julia, to walk us through the first example.
Thanks, Erin. I'm going to share a few insights from our work with the Rockefeller Foundation around what they call climate-informed health action. So as context, the Rockefeller Foundation has been a leader in the kind of climate and health agenda globally, trying to define what that looks like and what it means for health systems and other actors. And I wanted to explore specifically how integrating climate information into health and other emergency response systems could improve health outcomes. They've recognized, as we've just talked about, that climate risks are evolving rapidly and the impacts on human health are growing dramatically. And despite an increasing recognition of these factors, our systems are not yet well equipped to anticipate, prepare for, or respond to climate-related health threats, including many of the ones that Erin just mentioned. And that's, as is often the case in public health, given the need to work across social determinants and across systems, there are many silos that are preventing informed, coordinated action. So we work together with the Rockefeller Foundation to really map some of the key steps and types of interventions that can help to strengthen system preparedness and response. So if we go to the next slide, building on input that the Rockefeller Foundation had gathered from many of its partners and collaborators around the world, both in the US and abroad, as well as case studies of interventions in different cities, we identified 3 key ingredients necessary to strengthening responses to climate-related health threats. And you see these on the left side of the slide. So first, really focuses on data and the integration of better climate intelligence into health and other surveillance systems is critical, which can look like, for example, partnerships with meteorological agencies to generate health-relevant climate data. It can include tools and systems for monitoring and modeling climate events and establishing specific triggers for when to trigger action to protect health. And of course, local vulnerability assessments that map down to a neighborhood level which communities may be most at risk during a climate-related health threat. And many of you mentioned in the chat what those different risks can look like, including disruptions to healthcare, exposure to heat, et cetera. So this vulnerability assessment piece and having really clear data and information on who is most at risk is, of course, especially important as we look to take an equity lens. The second key factor is about connecting this intelligence to planning and decision-making for anticipatory action. Here, the key is looking across sectors. So ensuring that teams from the health sector, but also from emergency response, from urban planning, from water, from energy, from all of the other sectors that we know are important to protecting and advancing health, can come together and can actually use the climate intelligence that's been generated to develop anticipatory action protocols. And that those protocols prioritize the needs of the most marginalized and at-risk communities who have been identified through some of those vulnerability assessments. And the third key ingredient here is ensuring supportive policies and financing are in place ahead of time before a health threat or a climate event takes place to enable quick, direct responses that are well coordinated and supported. And so together, what we've seen in many different contexts is that these factors can lead to direct responses that are earlier, that are more effective, and that are more equitable, ultimately allowing communities to protect themselves from climate health threats because the systems are more prepared and able to respond. So I'll give an example of what this looks like in practice. And I'm going to share a case study from Dhaka, Bangladesh, which obviously is a very different context from Houston, a very different health system. But what we've seen across our work in many different contexts is that some of these core ingredients really do common, although they of course need to be tailored and there are different challenges. Many of the sort of core components of what climate-informed health action is and what makes it effective look the same. And so Dhaka, like Houston, is very vulnerable to extreme heat. And not dissimilarly from the Houston data that Erin mentioned earlier, has seen rising deaths and health impacts due to heat waves, especially among those who are most socially vulnerable. And previously, Dhaka wasn't integrating climate information into its surveillance and response systems. It was leading to fragmented efforts to address heat risks. So responses were limited, they were very much reactive rather than planned ahead of time, and they were somewhat ad hoc without clear plans in place to activate in the event of a heat wave. As a result, Dhaka saw mortality rates increase 20% during heat waves due to humidity and extreme temperatures. So what did leaders in Dhaka do? If we go to the next slide, a few of the key components that helped to strengthen their response. First, they instituted an early warning system in partnership with the meteorological department with different warning levels established. And he conducted assessments of risk factors for the most vulnerable communities in the city. They then established early action protocols, actors from across sectors, including hospitals, emergency departments, disaster relief agencies, and media. And crucially, this included protocols for how to communicate early and often with the public about risk. And in terms of the enabling environment, they also invested in really building a case for why heat early action protocols could help improve response in order to attract more financing to support these responses. And they established a policy framework for extreme heat response. And all of this enabled earlier, more effective, and more equitable responses, including interventions like cooling stations, first aid and ambulatory services, and of course, again, with a particular focus on communities that have been identified as having some of these intersectional vulnerabilities that we've been talking about. And these protocols were activated for the first time last year and reached an estimated 300,000 residents, enabling fewer negative health impacts ultimately from the heat wave. And I think what we learned from this example is the importance in these end-to-end solutions, data to decision-making, to planning, to execution, of taking a multi-sectoral approach, of integrating climate and health information, and of building in that equity lens from the get-go in order to build community resilience to health threats. And I know many of these efforts are underway in Houston already, so I look forward to learning from you all and hearing your reflections on how well this is happening in Houston today. But first, maybe I'll pass to Robert in case he wants to add just a couple of reflections. We did some related work also with the Rockefeller Foundation in Santiago, Chile. So Robert, over to you if there's anything you want to add in that work.
Yeah, just offering one similar example from work we did last year in Santiago, Chile. And the key there, building on the multi-sectoral, was using a very collaborative, participatory approach to bring stakeholders together from the public and private sector to align on a set of use cases, whether it was around municipal workers who were out and exposed to extreme heat, whether it was, people in aging homes and nursing homes, and trying to come out of those with some alignment around both which use cases mattered most to the city, as well as the kind of data that needed to be shared and developed. So putting in place around that data agreements with hospitals to try and figure out how we could tag, admission rates into hospitals with conditions that seem to have some relationship to extreme heat, because that is the big risk that they're facing in Chile these days. So anyway, it just we were getting very much into under the hood with these folks, and really trying to kind of make that a very collaborative process that brought together community organizations and grassroots advocates all the way up to folks in academia and the government, to try and use those use cases to align really around how to better share data and who can have access to it, and in particular how to get that out to the community.
Great.
I can shift now to Laura for our second quick project spotlight. So over to you, Laura.
Wonderful. Thanks, Erin. And great to meet you all. I am going to be sharing a little bit today about a project we did with the Robert Wood Johnson Foundation that was focused on global health trend sensing for health equity in the US. So here the idea was we worked with Robert Wood Johnson's US Global Solutions for the US team. And the idea was to say, okay, we know that the US is facing major inequities when it comes to the institutional, systemic, and social practices that influence social determinants of health, and also major challenges in terms of affordability, access, and quality of care. So looking globally to say, what can we learn from other countries and examples on some of the biggest trends in health equity to watch for, and how could we bring some of those innovations here to the US to support more equitable health outcomes. In terms of the project impact, the focus was on drafting RWJF's kind of flagship report on trend sensing. And the idea with the report was really to equip US health practitioners with a sense of what the biggest trends in the health equity space were, and innovative ideas on how they could tackle those challenges here in the US. In terms of identifying the 6 trends that we have here, the process included a combination of social listening via Google search data, and then a Delphi inspired survey process in which we received input for a number of experts and did kind of sequential voting in order to identify these 6 trends as the biggest trends to watch in health equity going forward. And there was a specific focus here on trends relating to social determinants of health, so taking a broader view on what we were considering in terms of health equity. In terms of the trends we found, the first was around growing calls for more equitable care work, so recognizing reducing and redistributing unpaid care, which is disproportionately carried out by women, and the key connection there in terms of supporting women's economic empowerment and health equity. The second was along greater longevity and looking globally and saying that in general, lifespans are increasing, making it really important for communities and health systems to support older adults and engage them productively in society. The third trend was around the increase in digital health information, and how for some communities this could be a benefit and create kind of an empowering situation for them to have more information about their healthcare, but also risked leaving certain populations behind. So folks that were less equipped to access digital health information risked not having kind of an equal playing field as others with access. The fourth was around the compounding housing crisis, so looking at how inflation, climate change, migration, and urbanization were exacerbating the global housing crisis and the impact that that was having on communities around the world in terms of implications for health outcomes. The fifth was on increasing risks to nutrition security, so likely one that's highly relevant in Houston, given the prevalence of food deserts, but looking at how climate change and global shocks have been undermining nutrition security and worsening nutrition-related health outcomes. The sixth, also likely highly relevant in Houston, given the intensity of heat and air pollutions, but the demand for growing healthy spaces. So creating more public spaces where people could be outside, shaded zones, and ensuring that those are clean and supportive of healthy outcomes. You'll notice here we actually don't have climate change as a trend. And initially it was on our list, but we realized it was such a key factor in all 6 of these that we integrated it as a cross-cutting dimension throughout each of these trends. So within the final report, we did a double click both on the impact of climate change and the intersection of each of these 6 trends, as well as AI, which was one that came up many, many times. So looking at across all 6 of these trends, what was the intersection with climate and what was the intersection with AI? In some of our examples, we also pulled out this dimension of multi-solving. So the idea that a single solution could address multiple of these trends. So looking at solutions that could address both climate change and the housing crisis, others that could look at the intersection between climate change and longevity. I'll provide a bit of a double click on the nutrition related trend, just given this is likely one that's most relevant for Houston. So what we found here in terms of the US context was that poor nutrition has a significantly linked to obesity. So nearly 74% of adults in the US are overweight or obese, which is incredibly costly to the US healthcare system. And the share of the population that cannot afford healthy food is 5 times as large in the US as it is in Germany, France, or Denmark. And as Erin and Julia touched on at the beginning, we're seeing really inequitable spread of these outcomes as well. So people of color are more likely to live in food deserts, reducing access to nutritious foods. So only 8% of Black people live in a census tract with a supermarket, compared to 31% of white people in the US. We also broke down the percentage of Americans experiencing food insecurity by race. So comparing here, you'll see the share of white Americans is much smaller than Latino or Latina Americans and Black Americans at the bottom here. So showing that the impacts of this trend are highly inequitable within the US. In terms of the intersection with climate change, we were exploring how many populations in the US are dependent on monocrops for their food supply. So probing the question around how could agricultural systems be transformed to foster a more diverse and resilient range of nutrients for consumers. In terms of some of the spotlights that we wanted to highlight here, this is just a selection. There were many more global examples included in the report that we thought would be relevant to the US, but to highlight a couple here, one was the 1 Million Kitchen Gardens in Kenya. So this was an initiative that was launched nationwide in Kenya to support rural and peri-urban households with growing vegetables, herbs, and improving food and nutrition security. So helping people with the tools they needed to grow their own nutritious food. The second was looking at urban agriculture in Singapore. So Singapore has a really innovative urban farming initiative. So their goal is to produce 30% of its own food supply by 2030. So reducing their reliance on imports and also enhancing local food resilience. So the final report also included many other kind of spotlights from around the world, but just wanted to share these as an example of the innovations that we thought could be useful for practitioners here in the US. The last piece I'll touch on, just recognizing this group is really focused on climate, is a piece that we shared with folks to kind of spark thinking and get the framework of how can we look beyond the US for solutions and bring those back home. So what we shared with folks that we were interviewing often was this graphic here, which shows the US broken out by different climatic regions. So and showing what countries around the world have a similar climatic zone as that part of the US. So you'll see here we have Houston at the bottom is falling into the central China and northeast Argentina zone. So in speaking with stakeholders, we would use this as a prompt to say, we know we're facing many of the similar challenges. Are there innovations from a country on here that we could learn from to apply back home in terms of addressing climate change and the health-related impacts? I want to make sure we have time for questions. So Erin, we'll pass back over to you and happy to take any questions in the discussion.
Perfect. Thank you, Laura. And thank you all for the engagement. And I've seen a lot of really exciting resources relevant to the Houston area and Texas come across in the chat. and also some initial questions. So the floor is now open. We can take down the slides so we can also see each other. And I saw a couple of questions already come through in the chat. So maybe we will start there and then would encourage you all to put more questions in the chat, or feel free to raise your hand and we can welcome you off mute. But I see Shrila's question in the chat to start us off. And I don't know, Julia, if you want to say a few words on that, and Robert chime in, of course.
Happy to. And the question for those who are not tracking was if we can share examples of how we take existing assets, reports, and data into consideration for our place-based approaches. And it's a great question. And I think, as Erin shared at the beginning, you know, we bring a global and often national perspective to our work, but we recognize that the communities that we work with are the experts in these issues and how they are affecting lives and lived experiences on the ground. And so we always look to build from the existing assets, reports, data in that community in terms of then a starting point for working together to find solutions. And I can share an example from some work I'm leading right now with the state of California and their public health department to develop a statewide health equity plan. So we've been working with programs and local health jurisdictions from across California to really say what are some of the priorities in terms of health equity in your context, and how can we build towards collective statewide action and tracking of progress across those priorities. And we've started with quantitative data and kind of leading different local health jurisdictions through a process to say, where are you seeing the greatest inequities in health outcomes? Where are you seeing inequities in the underlying drivers of those health outcomes? And what does that mean for strategies? And one of the most important pieces here has been that the quantitative data we know doesn't tell the whole story, right? And so we start with the data that's available, but we've really been encouraging our partners build from the data of lived experience, which I think too often gets deprioritized in our public health work, but recognizing that just because it doesn't come in a dashboard with a bunch of facts and figures doesn't mean it's not just as important to driving our responses. And so we've been working with them to think about how they triangulate quantitative data with, you know, their community health assessments locally, with community engagement forums, to really make sure that they're layering in all of those different sources of data to get to the best solution. So hopefully that answers the question, but would invite my colleagues in if they have anything to add.
Thanks, Julia. The other question I saw in the chat from Kayla is if someone could speak to how the new administration and funding cuts could impact this work and future initiatives based on previous comments around climate change. And so I think this is a bit the elephant in the room and the million-dollar question at this moment. And I will say that kind of we as a firm, and I imagine all of you in your work, are really closely tracking the political climate right now. And that's both, I think, most acutely at this moment at the federal level, but I imagine you all are also seeing it at the state and kind of city county level as well. I will just share, I think, what we are seeing amongst our clients, and quite frankly, what we're thinking about is Dalberg, right? Like, we have equity, justice, mobility, climate change all over our website. Is we're thinking through live what are the ways in which we can refer to this type of work, the frames on this type of work that will be less politically charged. And so we're seeing clients shift towards talking about being responsive to climate shocks, but not, you know, like scrubbing websites of climate change, et cetera. Talking about climate resilience, et cetera. Similarly with health equity, obviously that is a very charged term right now. And so, you know, kind of thinking about the language that we use intentionally, not taking it out of the work that we're doing, because we all know how important that is, but thinking about the language. I will say, and you know, we have clients that are doing the opposite. And in many ways, Julia was just talking about our work with the state of California. Like, we're seeing some of our public sector clients wanting to lean into the messaging when they feel like they are in an environment where that's not going to put their funding at risk. And so I think it's very much a kind of personal or institutional decision at this moment. But the kind of greatest shift that we're seeing is around really being intentional in the language that we all use to make sure that it's less politically charged. I think the other big impact obviously is going to be on funding streams. And I think there's big questions right now about how public funding streams especially may kind of further deprioritize this type of work. And I think there it's going to take a lot of creativity, unfortunately, on our collective parts to find the resourcing to continue the work that we're doing. And most likely a big push from both the philanthropic sector and the private sector to fill some of the gaps that historically have been funded by the public sector, unfortunately. So not the best answer to that question, but hopefully at least a bit of what we're seeing amongst our clients in this shifting political moment. And I don't know, I'd invite my team in too if there are other kind of ways that you're seeing this come up in your work or other shifts you're seeing clients make as a reaction to it. Great. Other questions, or I guess things that people are sitting with, ways that you're seeing this impact your work locally in Houston that you want to share with the group or get input on?
I want to share Peter Dured's comment. He also, as a shout out, made some beautiful visualizations for these past sessions we've had with Alpha Chimp. But last week I was with 120 plus researchers dedicated to civic science, connecting science to communities, and was emboldened by these young researchers who acknowledge that the work matters. And I don't know if you have seen that in your research, but also that in general, Gen Z, at least from what I've read, this is an issue that's very important. Because, the claim is, well, I'm going to have to deal with these consequences, assuming I live for the next 60 or 80 years,
Yeah, I think that's incredibly empowering and powerful to think about the ways in which especially kind of youth and the Gen Z community is stepping in to both acknowledge some of these shifts and really try to tackle them. And I will say one of the kind of tenets of our work, and Julia touched a bit on this in the Rockefeller work, is very much seeing communities as a part of the solution here. And so I think that maybe is another way to think about how we react in this political moment, which is to say, how do we kind of mobilize broad-based responses that kind of each member of a community can take on and champion themselves.
It's your research point, because I think, and this is of course my own opinion, so I don't, but what about the lifestyle changes required? Some of our mass consumption practices, I wonder if research will require, or is pointing that will require that to really affect or mitigate some of these risks as a society of mass consumption.
Laura, I don't know if that came up at all in the Robert Wood Johnson work in terms of lifestyle changes or otherwise.
In terms of lifestyle, I think we were actually looking at the opposite end of the spectrum and saying, recognizing the trend towards aging communities, how would we be supporting those communities? But I think the point is an excellent one around shifts in younger populations, but wasn't specifically a focus of the research that we were doing, given the primary focus was kind of on health equity with the climate lens built in. But I think if you lead with climate, it definitely shows kind of great engagement from that cohort.
I have a question. As y'all are thinking about climate health in communities, are y'all prioritizing also based on, I guess, leaning into what Wes said, what are the primary drivers of for climate health in those communities, right? And then prioritize, because not every form of mass of consumption or waste contributes to climate health in the same way, right? And every community has different, like we're an oil and gas community here in Houston. Certain sub-communities have specific challenges, right? Concrete batch plants, which contribute to pollution and climate health issues. So do y'all prioritize, and I'm guessing the answer is yes, but is there just, sometimes there can be discordance, right, between what is the data showing from a quantitative side in regards to prioritizing versus community perception in regards to prioritizing. So, and sometimes some of the largest contributors to climate health can be invisible, right? So they're not even in the ethos of the community at all. So can y'all speak a little bit to that as well?
Yeah, I can jump in a little bit, both from my experience in Houston as well as the work we did in Santiago. And I think there are a few dimensions that start to show up. You know, there's this dimension of kind of the urgent issues and risks communities face. And that creates motivation. We happen to be doing our workshops in Santiago close to a political cycle, a mayoral election. So that creates certain opportunities and certain urgencies around certain issues. At the same time, if you think about some of the work that we've walked through, there's a lot of more fundamental things like data agreements and data infrastructure and physical infrastructure that's much slower to change and that requires longer cycle planning that may provide that ultimate benefit to the community, but the community may not see it immediately. And then there's politics, you know, and in this case, the politics factored in. So there's this, the positive part of me feels like part of what we can do well and be helpful with is to figure out where that intersection can be the most productive. So what are the urgent immediate needs? Like in Chile, it was for a lot of heat alert systems. And what could you pull through when you layer those systems together and you develop them in collaboration with community actors, community organizations, that also starts to bring through and break through, you know, some more fundamental questions like how is your health data becoming more climate aware in the way it's structured and tagged, which is a huge problem. So few health systems, and we see this in other parts of the world, but so few health systems here are providing a layer of climate awareness and climate, you know, sort of correlation in their health data. So, you know, you have to be very, I think, creative in some ways and strategic about how you kind of find that intersection. And it's not just at the community level, but it's at sort of, you know, as you guys know, across many different levels, to sort of, for the political will to happen, for the longer term planning and infrastructure preparedness to happen, and for to feel like some of the immediate concerns they have are being addressed. And I know Houston, given how broad it is, given the number of fence line communities, given the multitude of both environmental risks and industrial kind of challenges and impacts, it's a very play out very differently in different places. So yeah, and often it's on the backs of big events that you can sort of level up a little bit of that infrastructure, but if you're not prepared and you haven't created that alignment ahead of time, it feels like it's hard to do.
Yeah, I would just add to that from an equity perspective. I think there's a tension that some of the most marginalized communities are at the front lines of experiencing the negative health impacts of climate change, despite not having benefited from all of the systems that created those impacts in the first place. And so I think it's important to think about where the onus of the solution sits, whether it sits at the community level in terms of behavior change, or whether it sits at the policy and systems level, and recognizing, as Robert was alluding to as well, that frontline communities are agents of change in both, right? And that political organizing and engaging with some of these system actors to make change on the mitigation side, in addition to the adaptation side, is really important. And frontline communities are often the best positioned to do that, as they know what the impacts are. We did some work last year with an organization called the Solutions Project. That's a funding intermediary that funds frontline climate justice actors, and their theory of change is very much about that, and saying the the solutions and the power to organize and change the systems we live in, as well as respond to the emergencies that are happening in our communities, really sits with those frontline actors who hold the knowledge, wisdom, and power that's needed to make that change. So I think it's a bit of a dance across kind of the different levels of our system, whether it's the policy level, the system level, the community level, and how we can all work together to drive that change without putting disproportionate burden on folks who are already experiencing the negative impacts.
Yeah, and I appreciate that last statement because it comes up often that, you know, we're exhausted from bearing the burden of constantly putting this in, you know, front of systems and stakeholders without having a lot of power to address the systems. And so I think that's so how do you activate the bigger, you know, players and other communities that may not be frontline or fence line to support this work. So I appreciated some of the examples that you shared of how you're kind of activating the systems and the environment, broader environment, in addition to specific communities.
The one other thing I would add on the question around behavior and lifestyle changes is within the context of the nutrition security trend we looked at, we did also consider who largely was making choices around nutrition. And as we want to shift towards more healthy food options at a very local level, who is often making those choices. And it came up as a strong intersection between the nutrition trend and the care trend, that it's often caregivers who are responsible for making that choice, and kind of the double burden there, both being the caregiver and responsible for shifting nutrition security outcomes. And then, of course, once you layer in climate change and the risks that that proposes to nutrition, there's a very strong nexus there of kind of how climate is influencing nutrition security, and the lifestyle shifts around that as well.
Real quick, as we continue this discussion, I'm going to put out our survey, and as we're talking, I just ask that you fill this out to give feedback, because it helps us you know, cater these sessions to the collective. So continue the discussion, but I'll go ahead and launch this poll. It's anonymous, and please fill it out for us. Real quick, I have Peter. I see that you announced also that Mexican architect Iñaki Echeverria had completed work on the Lake Texaco Ecological Project. This covers 14,000 hectares of how do I say that measurement? I don't even know. I'm sorry, but of land, making it one of the largest urban parks in the world, and is protected by federal decree as an ecological site. It was designed to mitigate the effects of density and climate change and improve communal welfare.
Great. And
Has a question. Sorry, no, I was just gonna make sure we don't miss Megan Rose's question.
thank you, Srila. So I see Megan's question, which is, have you seen examples where the data has shifted behavior and driven a measurable improvement in a health outcome? And so I'm trying to think about, I don't have any examples top of mind, but I will ask my colleagues if you can think of any. I think one thing I will share on this is, I think it often depends on who you are trying to influence. And so a lot of the work that we do around policy and advocacy kind of influence specifically, so that would be much more targeted at like government leaders, city leaders, et cetera. What's interesting there is, like, Erin, love data. If you're trying to influence me, I'm very rational and I would like data to influence me. But actually what we see a lot is that we need to understand what the individual who is making the policy decision is most influenced by, and that's not actually universally data. And so a much more kind of tailored approach to understand, do they listen to their key informants? Do they have a network behind them that they need to have whispering in their ear, versus is it a data-driven answer, can be incredibly important. And I think what we found, Robert, you can speak to this more probably, when we're trying to kind of influence at the community level, is that a similar approach is needed to really understand what aspects are most requiring of a data-based influenced approach versus word of mouth and others saying, oh, I tried this and I really liked it. I'm trying composting, et cetera, et cetera. So it's more just to say, I think we think about our influence levers much more holistically. And maybe that's telling that I can't think of a direct one that's data-based, but perhaps my colleagues can. I know we only have 1 minute left. So Wes, I don't know, I think if there are other announcements that you wanted to make in the last minute, I don't want to take that from you.
Well, first and foremost, thank you so much. And thank you everyone for filling out the survey. And also, Robert, we will share, you all agreed to graciously share the slides. So just know that we will send this out, the recording, the slides, and also there's been a lot of discussion around resources. So I'll be sure to download the chat and include that in the follow-up email. And just know for your respective organizations, if someone's not able to attend the session, we highly encourage you to subscribe to our YouTube channel. We post all these sessions up so that you can view and disseminate this critical information. Yeah, thank you all so much. And we will be sure to share all this information in the follow-up email to the roster. Yeah, and thank you all again, Dalberg, for giving us this 2-part series.
Thank you all for having us and have wonderful days.
Yeah, and feel free to reach out at any point if there's any of this that's of interest.
Okay. Yeah, we'll be sure to include your emails so they have them.
Thank
Sounds
you.
great. Thank you.
Thanks all. Take care.
Bye.